everyone who's here. This meeting is being held under Chapter 107 of the Act 2022, known as an Act relative to extending certain state of emergency accommodations. It was passed by the General Court, signed into law by Acting Governor Karen Polito on July 16, 2022. That legislative action revised Section 20 of Chapter 20 of the Acts of 2021, and in so doing provided modifications to Massachusetts open meeting law, which allow for flexibility to hold remote-only and hybrid meetings while preserving public access and, where appropriate, public participation. Currently, that additional flexibility will expire on March 31, 2023, unless additional legislative action occurs. As part of today's remote-only meeting, all votes will occur by a roll call. Welcome everyone to our meeting. Just about 9:05. I'm Edward Cosgrove, Chair of the Board of Health, and I guess I'll start with Kathleen Brown, who is here remotely.
Here.
She needs.
Thanks.
Okay.
Thanks.
And then Tijal Gandhi.
Here.
Stephen Epstein here, and Rob here. Okay, so we're all here. We're starting something new, which is the trial public comment period.
Yes.
Do we have anyone who?
So we'll talk about it a little bit more later. There was a resident who repeatedly emailed and called, and I can maybe get into the specifics a little bit later. And I invited her to come to do this. She decided she did not want to. We'll still present the concerns that she sent us by email, but one of the ideas was to give her the opportunity to do it as part of a trial, but she decided she didn't want to come and speak publicly.
Thinking about making this a potentially standard procedure at the beginning of every meeting. Let them do that. And, I think we would have, if someone did come and wanted to speak, we probably would have said yes anyway, but we'll just make it formal. Do you take a vote on that?
No, we can talk about it at the end of the meeting on whether it makes sense. We can also review the select board's policy and see if the board would want to develop its own that is the same or slightly different. The select board policy is, and we can get into it a little later, but I think it's valuable, but it's a little bit awkward because someone could talk to you about something and their policy is, thank you very much, we will take this under consideration. They don't agree with you, disagree with you, they don't, sympathize with you. So sometimes, depending on what the person is talking about, that can be challenging to just say, thank you, we have heard you, and not say more.
Okay. So we'll move on to review of the minutes of September 20th meeting. Has anyone got any comments on these minutes?
One comment is, and it's a comment, it's not a change.
Okay.
When you ask for internal, I sent this back not practically, but when we put comments for work product, they're not going to be public consumption.
Okay.
If you're asking, internally, because you sent an email to all of us without discussion amongst all of us,
right? For
internal comments, I think that needs to be very, very clear if you're intending to make those comments public or not.
Okay.
Because I see that my comments were that we read aloud without context, and without my ability to provide any context at the meeting last time when I was not present.
Okay.
And I feel like that should not happen.
Okay. Absolutely. I think we should do a better job figuring out what sort of, if you do want a public comment or if it's just sort of for the board's internal deliberations. Yeah.
Any other comments? Can I have a move to accept the minutes?
So moved.
Second.
You weren't here, so you're.
I'll second.
I can second.
And then the vote. Kathleen?
Yes.
Tijal?
Yes.
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 So it's 4 yeses and no abstention. The next item on our agenda is the safe capacity assessment update and review. Who's going to be Tiffany?
So Diana and I will lead that and just promote Diana as panelist.
Okay.
All right, so Diana is on. We've mentioned this a couple times, but the state is in the middle of a capacity assessment. We had talked to the Board of Health about it. It was one of the recommendations of the Special Commission on Local and Regional Health was to assess sort of the capabilities and capacity of local public health to develop workforce standards and to eventually ensure a minimum level of funding, which ensures a minimum level of service and capacity. So one of the first steps in that was a capacity assessment, and I'll let Diana talk a little bit more in depth about it, but we included the entire phase 1 of the assessment in the board's packet.
Can you guys hear me?
Yes, we can.
Okay. So basically, we are already in phase 2 of the capacity assessment. So if you remember from the last meeting, it's a 3-part assessment. The first part was the baseline capacity assessment that Tim was just talking about. I worked on it with Tim, Tiffany, Tara, and Carol Reed was in the room as well, helping us going through the questions. We were actually surprised that we weren't able to say yes to every single question because some things came up, for example, that we're supposed to be licensing funeral home directors, and some interesting things popped up that we didn't realize were necessarily responsibilities, or there was some questions that were kind of situational where these situations haven't happened necessarily. So like there was one question 16, in the last 5 years to avoid service shut off, has your health department or Board of Health certified in writing to the gas or electric companies of any residents where a serious illness existed and the customer couldn't afford to pay an overdue bill because of financial hardship. So in that case, like Eversource would only accept a signature from a medical doctor, which we do not have a medical doctor in our department, as is common among all different departments. So what we did was all the questions that we wanted to expand on or clarify, we wrote out this little document, sent it to the state after we had submitted our survey via SurveyMonkey. And then now what is live is the workforce survey. So all the staff members in the department should have received a copy. They actually extended the date. It was due yesterday, but they extended the date a couple more days just to have as many people answer as possible. That one was a bit more straightforward, I thought, and a little easier to work on. The baseline capacity assessment took at least 2 hours just to get through the first round of like going through the questions of what we could answer. And then there was a bit of extra time trying to reach out to other departments who take care of certain tasks to see how those things are taken care of.
Yeah, I was particularly interested. So it does highlight potentially the inequality that exists among local health departments. We had multiple management level staff members spend 2 hours going over a draft. Multiple management staff members do additional research. Multiple management staff members do a second pass, do a write-up of comments to DPH. You can sort of see if you were a smaller department or if you're a one-person shop, how that would be, we committed 30 or 40 man hours to it. How is someone taking a full week out of their normal responsibilities to complete it? But it sort of underscores the challenge, I think, in Massachusetts of how do you assure a baseline level of quality when there is such real disparity between the resources in different communities. As Diana said, we were surprised with some of the answers. Some of them are clearly outdated. Some of them are laws that are on the books that don't make sense anymore. For example, I'm not sure it makes sense for us to report at high noon on every Saturday all of the deaths in the town personally to the public health commissioner in the state, but that's on the books. We have plenty of tobacco control efforts. We've never been asked to share them with the state, but apparently we're supposed to every year. The state had never asked for them. I don't know if the state knows it's supposed to do that.
And the same
Some
was
of
like
them-
DEP. There was like that one that we're supposed to report stuff straight to DEP, but DEP doesn't answer. Or there's things like they wanted us to report to the state the amount of cases of cerebral palsy, but we don't get that information necessarily from the hospital.
Right. Yeah, DEP is supposed to get a copy as is the town clerk of all of our regulations every year. I asked multiple people at DEP and they all sort of said, please don't send this information to us. We have no use for it. So there's some lack of connection there. I do think there's some things we're going to move on immediately, and there's some things from this list that we're going to take a little bit more time. Permitting funeral home directors. There appears to be no reason that anyone knows in local public health except to have their contact information. So that's the only reason you're supposed to permit them every year, and you're supposed to share it with the state. So we will work to put in a no-cost permit for funeral home directors and say, we're sorry, this is an extra hurdle. We're, checking a box. We hope you'll take the time to check this box. There's no cost to you. That's a fairly, low-hanging fruit one. Some of the more complicated ones are things that involve, information sharing between healthcare providers and public health. In some instances, the healthcare providers share that information directly with the Department of Public Health. I'm not sure it makes sense to share it with us unless there was a reason we would receive that information and something we could do with it. But we were interested in it, and we will take some steps to sort of move forward to make some changes and to add some services based on what we found.
Yeah, most positions meant for reporters, you're not going to get a lot of this stuff like cerebral palsy. We're not for reporters for that. Right. And then it's so difficult to apply. Right. Privacy. So, can't get that. That's a conflict between federal and state law.
Yep.
Where the radius thing is absolutely absurd.
Yep. I think, we can trace some of those back, decades, some of them back, almost a century in some cases. A lot of things have changed. A lot of regulations and laws have been passed at state and local and federal levels, and they've never sort of been cleaned up. So I do think one of the first things that Governor Baker did when he was elected was called the Municipal Modernization Act, where basically they cleaned up a lot of old stuff on the books, simplified a few things, got rid of conflicting rules and regulations that was across municipal government. I do think this is kind of crying out for a piece of legislation that I'm sure no one will really be that excited about, but which will sort of clean up all of the contradictory regulations and all the old laws that are on the books.
Can I say something?
Ed's in charge.
Can I say something? One of the things, just listening and trying to contribute, and also being a Board of Health member, would be local hospital data that would help some of the requirements. And I know in working with my 4 towns, that's been a real barrier to getting deaths and reports that we could then maybe look, say, with our death certificates, just in that one situation. Also from our EMS, Tim's working with Tiffany to get data that way. But some of the data points that we could get from the hospital would be really helpful. And I just felt like I would add that. And I know you've all heard that before.
Once you've sort of gone through and you said there were some areas that you want to look into further and think about, is there an opportunity? It might be nice to just get a little, like a summary of, these were 5 areas we thought we should explore. We decided these 3 we're going to do X, and these 2 we looked into it, but we don't think we need to do it. Like, just to have some sort of summary that the board can see as a end result of all of this, because it was a lot of work, and it would be nice to see kind of what it leads to, locally at least.
Absolutely.
Yeah, I think Tiffany has started to do that in this memo that she wrote.
Right.
But she laid out the different questions and concerns we have about them.
Right. I mean, one of the ones that potentially is is easy but possibly important is I knew, and I think the board knew, that siting requirements for recycling and transfer stations, including composting operations or expansions, are something that requires local board of health approval. I was not aware, and actually, as you can see, the regulation is not specific, but it does say the board of health or the health department may license, regulate, and inspect the daily sort of operations, not just the sort of siting of facilities. And that's something we haven't done. We do work closely with the RTS, when they've had pest issues, when there's been other things, but we've never sort of formally inspected them. So that's something we could take up pretty easily. Obviously, we'd want to have a discussion with our Department of Public Works and sort of explain to them and understand it, but that's something we could probably implement, within a few months. Same thing with the funeral directors. I think we would just want to figure out how to, have a coffee and bagels or coffee and donuts to talk to them about. We understand this is a little bit annoying. We're not going to charge you for it. It is a requirement that's a law for us. We think it will, take 10 minutes of your time to fill out this online form. Would you please be willing to do this once a year? Rather than just kind of send them an email saying you've got to do this. So I think some of those are kind of low-hanging fruit that we'll tackle in the coming months, and some of them are, as we said, more complicated or just not possible because there's contradictory laws.
Mm-hmm.
But yeah, we can absolutely produce a chart and show you the progress on them in a couple months.
And I think where we find that some of these laws are either just outdated or ridiculous. I think working with Denise Scarlett, particularly our state senator, to just initiate changes and just, if it's ridiculous, get rid of it.
Yes.
And if it's a DPH regulation, work with them.
So, Diana alluded to the workforce survey that's in progress. There are performance workforce standards. A lot of them relate to the credentials, licensure, or certification of staff. So does your nurse have an RN? And there's required and recommended performance standards, none of which are actually required yet, but the hope is that if the state provides funding, that the state will also have standards for workforce credentialing and professional development. Needham as a whole meets or exceeds all of the standards. In some instances, there's a difference. So for example, in many cases, a health director is a sanitarian. Excuse me, I'm a director of health and human services. I'm not a sanitarian, but we do have a management level staff person in Tara who's a sanitarian who supervises all of the other inspectors, many of whom have significant credentials on their own. So, Needham is not a sort of perfect comparison for that, but we do meet or exceed sort of all of the requirements in the draft workforce credentials.
And that just is designed to point out the disparity between health departments across the state. Sometimes some departments are like ours. We have virtually everything. I won't say everything, but a lot of the things that we should have. And then there's others that some literally have nothing. We ready to move on?
Just a quick question on 168 about boarding. It's one of the only ones, or maybe the only one, so we weren't prepared to handle that. I think.
So I think it's
problem is for us, but the ones that we've had in the past seem to be well handled.
So I think they have been well handled. I think each hoarding case is different and unique, and they almost all are incredibly time consuming, involving dozens and dozens of hours of environmental health staff time, often including public health nurse time, almost always including social work time from our aging services division or from Springwell. So I think that was more of a, this is too complicated to say we have everything down. This is a really challenging issue, and it seems like, each year it almost becomes more challenging. So that was sort of the rationale behind that response.
Any other comments? Okay. With that then we'll move on to the healthy medium presentation. It's Ally Littlefield with Julie McCarthy.
Oh, I think Allie's not. She's on Zoom. Oh, she's on Zoom. Okay. So I guess I don't know, chime in if you want to say something, Allie, or you can start it. But basically, I hope you can all sort of access the website that I put the link in there for. I saw in a magazine from the software, GIS, or the website is hosted, an idea that sort of talked about promoting local establishments within a community and the menu offerings that they had. I think it was specifically for being, vegetarian or vegan options. And I thought that this would be a great thing to incorporate into our nutritionally needed program, which Ally spearheaded last year. So we talked about doing this, and unfortunately, we didn't have a lot of interest from the restaurants in continuing that participation. I think they just kind of found it difficult to engage, pick the menu items, put up the signage. There wasn't a ton of interest. So we decided to sort of shift gears and expand the concept of nutritionally need them and make it healthy need them, which is sort of more broad and was inspired by the things that were said at board meeting many months ago, where it was discussed sort of the consequences of the pandemic, people who are not, as active as they used to be. And I believe it was Kathleen who had given some statistics on this. But we decided to create this website that sort of maps out where resources are within Needham for things like parks and playgrounds and trails that people may not know exist and could promote that active, healthy lifestyle. We had hoped to put the restaurants in there, but without the interest, we decided to omit that part for now, and maybe we'll get some interest later on to give it to identify federal and state and local resources for things like food safety, for food access, information about WIC and SNAP, and places within Needham that accept WIC and SNAP, because having access to food is really the fundamental start of making healthy choices. And this site is sort of the beginning of what we like to create. So we started off with just the getting moving, food access and food assistance, food safety, so how to cook food at home, store food at home, prepare food at home safely, and nutrition. And we're hoping to add on to these topics, as well as add other topics like perhaps stress management or food waste, sustainability, things like that. So we just wanted to show you sort of what we've got on this website and the capabilities of the mapping technology that come with our GIS, and being able to have people scroll through a list of things and find directly where these resources are in them, and just see if there were any additional sort of thoughts on what we can add and incorporate into this. I don't know, Allie, if you have any other thoughts, or if Allie could hear me at all.
I think you covered everything.
Okay.
Are there any comments from anyone?
So there was an article in the New York Times in the past couple of weeks highlighting several apps, and I think they know apps, but God knows people who have phones for what it is. Highlighting what some businesses are doing with their leftovers. There's an app called, I think it's Too Good to Go or something like that, where restaurants will repackage food, basically their daily waste that they would otherwise throw out and sell it at a discount, significant discount. Other grocery stores will sometimes also, be selling office, things that are expiring, something good. Getting those resources on the website.
That would be great. Thank you.
Can you talk a little bit more about sort of how residents will know that this exists? I think it's a great resource, and so how you're planning to promote it.
That is a great question. Allie and I went to the Harvest Fair recently to start promoting this, I'm not sure that that quite did the trick. We had sort of the QR code for this that we were hoping to get people. I think people were interested, and I found actually most of the people that came over to our table were shocked to find how many trails there were in Needham, which I thought was, you know, a great promotion for this. But that is something that we need to work on, and we're hoping, you know, we have to make the site also appropriate seasonally, because right now we're highlighting a lot of get outdoors, but I mean, I personally don't get outdoors a ton in the winter, so we'll have to find other things to incorporate into the website to promote for the different seasons. And I think that could be a different, a nice way seasonally for us to find some opportunity to relaunch and rebrand sort of the website. But we have a lot of brainstorming to do on that, honestly.
Well, I was thinking about, well, certainly the senior center, but also the newsletters that all the schools send out weekly. Every school does it, and they always have all kinds of links and announcements and stuff. That just might be another opportunity.
Yeah, that would be great.
And of course, the town newsletter, town website.
Yeah.
I love it. Thanks. I know. Oh, sorry. Is it all right to talk? I was just going to say that I really like it. I do think there's a lot of, health impacts, obviously post-pandemic, that were already problems before the pandemic. I think a couple of things that I liked, I was at the farmer's market on the weekend. They started to accept SNAP and WIC, which I think is, I don't know how many users there are, but I think that's an important thing. And so maybe we could add a link there saying like the farmer's market accepts us. Shoot, I had another one. And foods that are in season are usually cheaper. And I think adding something about like what's in season now. I know that is a labor intensive, but sometimes you can just have a chart by month or something like what's in season. So that might be something, without having to print it out, we could stick it on the website. I have a sample. I can send you guys a picture. And thanks for going to the Harvest Fair. I think it was a great event. There was a lot of civic engagement, and SPAN was there as well too. So it was a good event. Thanks.
I agree with Kat, and I think that was a great place to showcase it.
Yeah.
The health department had a good show there.
I thought it was a great document. I just wanted to also talk a little bit about access. Inflation gets worse. Access to food, and especially healthy food, it's going to get harder and harder for people. So, like Steve was talking about, places that are donating food, access to that. But if there's anything else that we can put on the site, we can make it snap. One idea I was thinking about as I was reading this last night is, maybe we should, the health department could sponsor like gift of nutrition or gift of health, there's a gift of month. And we've seen those applications have increased this year. When I've been in the grocery store, I've heard people say just out loud under their breath, I can't believe how expensive food is. So, importance of access.
Somebody else do in that day, business, but it's cost too much. You just need to know what to purchase and how. And you need that information out as well. And I'm sure you can browse on the website, maybe never getting full real food that's not processed is actually not that expensive. It's more expensive now than it was, yes. But if it was for all restaurants, maybe they're having too much trouble with their menu, but maybe they're willing to offer a recipe on the website or something that is inexpensive and can be costed out and maybe provide a little bit of nutrition. That too.
Yeah, we'd love to be involved with the restaurants just because it really promotes that resources within the thing. So we'll try again. Yeah.
But I can't think of stressed out because of the pandemic.
Yeah, I think a lot, had to do with the fact that they're understaffed as it is. So
yeah. That's a great idea. And I think you can bring receipts, but it's not only what to buy, it's when to buy it. And that's where you get into the seasonal foods.
Yeah, absolutely. Thank you so much for that.
All right, so we move on to our next presentation, which is the draft food policy, updated food code. And then again, Ally is online and Tara.
So as of, this is kind of a continuation of last month. So just to give everyone a quick update, we did beef up the violation section a little bit more, putting some definitions in there so that it was very clear what the definition of a non-priority violation was in reference to what types of priority violations they were. So that was the biggest tweak I think we made since last month to this document. But other than that, I think it was pretty much the same. So again, we're just looking to the board to see if you have any questions or anything to add to this. I mean, we're looking for your approval because I think for standard 6, for FDA standard 6, we just need to have a code enforcement on the books that the Board of Health approved. So,
and we do think this hopefully hits 2 birds with 1 stone. I think it answers the questions and the requests the board had in light of some of maybe the challenges we had with misunderstandings with Rice Barn and Recode, thank you. And sort of clarifies our process in more detail. It also does meet, as Tara said, the food code standard. So it was a lot of work by Tara, by Ally, by Lynn to put this together. And obviously, as you can see, it's by far our longest protocol.
As a shared restaurants.
so we are having our food advisory board coming up at the end of this month, and also 4 trainings coming up, which we're gonna promote this as far as getting the education out there. That is our next goal once this is pretty much finalized. And so that was the next step. So we've given them a quick heads up on it, but this will be our venue when we have our food advisory board trainings.
Yeah, kind of like get some feedback before we sign off on this. So.
Yep, so we have our food advisory board coming up at the end of October. We have that penciled in for the last week in October. So we can definitely hit this, and that was our goal to get this out there. Give everyone a heads up about it. Everyone knows about the reinspection fees. That would be new. The newest piece of this, I think, would be like the ticketing piece, which is what we have to educate our restaurants on.
And who's on your food advisory board?
So we have representatives from different stakeholders. So in previous years, we've had like Sweet Tomatoes, so restaurant owners and managers. And then we've had, you know, Amy now, who's the town that works with restaurants. Again,
Unit Hilson, the economic
developer coordinator, she's involved. We have the commerce, so New Needham Chamber involved. So, and then some residents. We had some residents that were also involved last time around. So we have about 10 to 15 inquiries of wanting to join this time around. So we did it virtually last year. We'll be doing this virtually this year. So we'll be trying to get this out to them and then getting more members involved as well.
How do you promote that through them?
So we have our email list from the food permit list that we shoot it out to everyone on that list. And then we try to like tweak the previous members that have joined meetings before. So this will be our 3rd food advisory board meeting. So we'll just, again, try to make sure everyone can attend, and we're going to record it as well and then send the recording out to everybody so they have access to it again.
I do like Steve's idea of, you know, just getting feedback from the restaurants about it, just to make sure there's not something that seems totally undoable for them. And I just wanted to thank you because I do like the little flow chart you made, which I know I had asked for. So I think it makes it hopefully clearer to people.
Yeah, and our intern helped us do that, and it's great.
Yeah, I think that is a nice result. Well done.
Is the fee for municipal inspection $125?
So we checked our fee list, $150. That's it for the 3rd inspection. So we have initial routine, we have 1 free follow-up. If we still find the same violations, again, we go back to the 3rd. That's when that fee gets triggered.
So I use 3.
Yeah.
It says it's 125.
Yeah, and the flow chart is D under third inspection.
Right.
Listed.
Okay, let's do that.
Comments?
Third inspection. Necessary approvals.
More comments? Then with that, on to the their naturals.
Okay, so in front of you, I put a new label, I printed it out. Sierra Naturals is again looking to tweak their wicked labels as far as these are their gummies that they had previously in years past, as you recall, this label had come to us for review. And the board at that point had said it looks like a bubblicious, gum label with the bubble letters and the colors. So you were able to tweak that down to that more standard, less bright label. And now they come to us again with another proposal, which was initially this label. Yeah, this is the one we tweaked it down to initially. So this is the one that was initially proposed. They had since updated it to this one, the one I put in front of you, because I printed that came in after. So I think initially we were thinking these are bright colors. These are still looking very attractive towards children, which I think is the board's goal, not to have this be attractive to children. That's why we had gone to that other label initially. So we're just looking for your feedback on that proposal so we can let Sierra know how to move forward.
And where would this little label about the medical marijuana thing go?
So they usually would have it like on the back or on the side of the packaging. That's typically what it would be. But this one actually is more out of the realm of our reg because it doesn't even say medical marijuana on the label, which is what we require. But I think this is what Somerville and Cambridge have on their labels, which are the other two Sierra Naturals facilities. So they wanted to be aligned more with their other two dispensaries. However, Needham has our stricter regulation that requires it to be more,
And what's the font size?
I think they meant the font size as far as that, but we could also, it looked a little smaller actually.
I got my readers on it.
Yeah, so we can make it.
I think it's very hard to, this one doesn't even say it, which is,
Exactly.
and even on the one that you had sent us online, I thought it was pretty pretty small. But.
Yeah, and what they've done, just so you know, for the other one, they had a sticker that they put on, medical marijuana sticker that they would put on the Needham labels, and that's how they would accommodate our regulation in Needham. So, yeah, so that's what we're just trying to see.
So I was just going to ask about the state labeling requirement. So for there aren't any, or like, I don't know. I guess we just had a meeting where they discussed selling products that aren't just made in-house, right? So are we reviewing every label for every product that'll be sold?
Right, if they have a new product or label come through, they typically send it to Ally or I to get approval for it. So we have that, and that's how this came about. Okay. They had said, okay, we have a new label proposal for our Wicked Sour products. And so when I saw this initially, I said, well, this is right, this is, so that's what triggered it. And I talked to Tim about this. I said, this is something we have to bring before the board because this seems to be very attractive to kids. And then when they came back with this one with the bubble letters again, I said this was denied before.
Yeah.
So, and I mean the not safe for kids is tiny.
Yeah, and font size.
Yeah.
Yeah. And even beyond the bubble font, it's got like something that looks like a little explosion. It looks like it's a cartoon. Some lightning bolts in there. That's definitely, in my eye, much more attractive to children. Even the other one has the bright colors, but at least the font looks a little bit more grown up, not necessarily so attractive to kids.
We can go back to this one. I mean, I showed you the other one, but the basic one, we had to do the brown color, wicked sour, so it was definitely. Yeah, so this one, like that you'd allowed, you know, the brownish color was purple, wasn't as flashy, had block letters, were big. That was something.
If we don't have a font size standard, we probably need to come up with one.
So I don't know if I could go back to them and say, tone this down, you know, so it's not attractive to kids, and see if we can do another round of review, or like, that's what they had done with this one. They came back with this one, we reviewed it again, and this one was approved. So,
And I frankly like the approved one.
or we could just go back to say, this is what we approved, this is what we would allow, something similar to that.
Yeah.
I mean, regardless of colors, they draw you right to it. This is, well, okay, this is a little more sober. I mean, even this version isn't that bad.
I still wonder if the not safe for kids thing needs to be, because I mean, it just feels like it's, yes, it says it, you know, contains THC, but that not safe for kids warning, I feel like should be bigger, but.
And the FDA warning, I'm looking, they're running that into their testing, and I'm wondering if those paragraphs need to be separated. You know, this product is not analyzed by the FDA, it's a separate requirement. And they're kind of burying that in that one regulatory paragraph. And I'm wondering if you can, or if they separate out those paragraphs. That, you know, the state one that requires that statement has to stand alone.
Or bold it.
In the middle of everything else.
We could bold it or something too.
But they already have the correct bolding in there. This product away from children is bolded, right? But it's buried in a lot of other text, which is not part of the required warning.
Yeah.
So separating that out very more common.
As you read across, you can barely read on the right side.
I can go back to them and give them that feedback.
So warning needs to be in contrast. It's going to be large enough. It's going to be contrast. Read by somebody that understands.
Well, and I think to that point too, that it's buried in the color, but even those white lines behind make it harder to read that whole paragraph.
I think too, I mean, I agree, I think the not safe for kids needs to be much more prominent.
Ask a question.
Okay.
To clarify, so we don't require the sticker anymore for the.
No, we do. However, they had, you know, submitted this as an example of the newest one, but they would put the sticker, like they had to put a sticker on items from the get-go when we had that regulation. So we would require that.
Okay, so if they do, let's say they approve that, they would add the sticker to that.
Correct. Yeah. Yeah. Like this, we have them put the sticker on this one. Okay. We verified it.
So the next thing, I mean, just I'm anticipating where it's, what if they were to take this very brightly colored, attractive package and put it in the brown paper bag without warning on it? So they sell it in the brown paper bag. Somebody takes it home and then, you know, see this. Are we okay with that? It's just something we need to think about, because that is really necessary, right? Because right now they're sticking a label on. It says if I can put it in the bag in the store, and then take it out.
But I mean, is our concern, because we're talking about medical marijuana patients with a card in a medical dispensary, our concern isn't necessarily that the people going in are particularly attracted to the packaging, right? It's more when it gets home, what does it look like?
Yeah,
Exactly, correct.
I mean, there are 18-year-olds who have medical marijuana cards, and we know the brain doesn't fully develop until 24, 25, but we are less concerned about that than about
an underage 14-year-old that I saw last week who was high on marijuana and showing some psychotic symptoms, who does not have a medical marijuana card. How they got a hold of it was kind of an interesting question for a psychiatrist to figure out.
So last night Karen had a great forum and most of you were there. I felt it was powerful. She shared data from the Metro West survey on access to marijuana, and the high school youth reported the percentage, I wrote it down, putting you on the spot, Karen,
Yes,
from an RMD.
10% of high school students reported that they bought it themselves at a medical marijuana dispensary. And then there was a slightly higher percentage, I can't quote myself to get that, but that they had someone 21 or over purchase it for them at a medical marijuana dispensary.
And
oh, that's true. It said marijuana dispensary. You're right. They didn't use the term medical. Marijuana dispensary.
But when you look at like your alcohol access, 50% got it from a parent at home with their knowledge. So I think we all know that no matter what, these things are in people's homes. So the packaging, if it's the way it was originally intended.
So, yeah, so if that's their proposal, the answer is no.
We would not consider it bad packaging.
Yeah.
That's just
That's just what it
Permanent.
In fact, a smaller kid could be attracted to that.
Oh, yeah.
Think, oh, hey, it's candy, you can't even read. And take it.
17%. 17%. Someone 21 or over bought it for them at a marijuana dispensary. 10% bought it themselves. And then a fair amount getting it from home too, with or without their parents' knowledge.
I think the chances of accidental use at home are the greatest with that kind of thing. I don't really like it. I like that nice brown.
There reports of purchases from that facilities.
Not that I'm aware of. Not that I've been privy to.
We've never done it in Lions County. That's kind of what I'm wondering. It might not be necessary, but we never check to see exactly how they're really checking out the marijuana parts of the.
I mean, when we go into our inspection, they know we're coming. So yeah, I don't think we're ever gonna surprise.
Meaning using operatives.
Yeah.
I would we could work that out with the police. I would assume it's a possibility. We probably want the person to be over 21, so it's just a question of this person is of age.
Bring my card
Just,
with me.
right.
That's going to be the thing, you know.
Yeah.
They have their license, they're over 21, but I just didn't bring my marijuana.
Yes.
Sorry, can't purchase. That's the
Right. It should be a very quick check.
Yeah.
So we have our tobacco checks. We're going to be doing those shortly, hopefully in the next month or two. So we could add maybe checks.
I'd expect that there is a combination at all, but
Before we do that, I think you got to work with the police.
Yeah, definitely. We do that with the tobacco.
Do we have to tell Sierra that we're going to be doing that?
Yeah, we can. I'll check them many times. So.
Any other comments? So we're basically making a decision on this right now.
We'll have them raise them there.
Our point, our opinions. Okay. Then I guess we move on to staff reports. So we start with substance use prevention.
During the month of September, we spent a fair amount of our time really planning our in-person presence in the community. And that involved meeting with school partners, tabling at events in person, and planning the first quarterly meeting in person that happened last evening. So we're really delighted to be able to do so much more now in terms of our outreach and raising awareness about the resources that are available to people in the community through SPAN. And being able to do so much more of that in person is a huge boon for everybody. We were at the Harvest Fair as well, really found the public to be more engaged in that Harvest Fair than I have for the past 3, despite the gale winds and the chilly temps. And then beyond that, we are planning with Carol Weed and Officer Jay Sullivan a third TIPS training for 2022 that will take place at the beginning of November. And there will be compliance check coming up before the end of this year as well. That's pretty much it. Just one last comment. SPAN partnered with Native 180, which is their coalition for substance use prevention, to become part of a cohort in New England that is participating through the PTTC of New England. And it's a cannabis prevention in the era of legalization program. So every month we'll be participating with this cohort of other preventionists around New England to really discuss and learn about best practices in cannabis prevention. So we're very excited to be part of that.
Thank you again for that presentation. That's nice.
Thank you for coming.
Yeah. Second, I'm glad to have seen that data, and I've been waiting for it to come out.
Well, thank you for your participation. We had some nice discussions as well. So I'm taking all that information back to the coalition and the action teams.
Very good. Comments? Thank you. We're up to COVID updates at the knowledge of Julie.
Just some brief comments on the COVID slide deck that I provided. So we haven't yet seen much of an uptick in our daily cases yet, but the wastewater data is starting to trend upwards. It's sort of doing this like up and down motion where we can't quite follow it, but generally upward trend, which isn't surprising as we're entering respiratory virus season, but it will be, you know, as it has been, a big indicator for us of, you know, to watch out for more cases coming our way, you know, locally and statewide. The vaccination booster rates, I think, will be an interesting metric to look at as the second boosters are now available to people, and as Kenna has been, you know, holding clinics here in Needham. I wonder if, you know, we'll see our first booster rates increase perhaps with the availability of the second booster. Sometimes that promotion does sort of push people to get their first booster if they haven't already. And I suspect we'll see the second booster numbers really start to increase in the next month or so. We've had a lot of interest here. The hospitalization rates also starting to see a little uptick there. Obviously something we'll want to keep an eye on as we're entering the winter and the inside, sort of all of that inside time, when we see increase in cases, to see if we also see an increase in hospitalization rates. But again, the number in terms of hospitalizations that we'll want to keep the closest eye on is that, you know, hospitalized primarily due to COVID in the last slide. I haven't seen much of a change there yet, but I anticipate, you know, in the next couple of months, we'll really want to keep an eye on that. That's about it for COVID. Questions?
I do know anecdotally that there were a lot of cases in the schools. I know we talked about that last time, but at the high school, at least, lots of cases. So.
And then with just among people that I know, it seems like there's all of a sudden cases. So.
Yeah, hopefully people will get out there and get their booster, and that will prove to be, you know, effective at least for hospitalizations.
Are we calling the second booster what I call a third booster?
Yes, yeah. Which is actually confusing statewide. They haven't addressed that yet, how they'll interpret that data, because originally the second boosters were only available for a certain percentage of the population, and now they're available to everybody, but they would be a third booster. So I'm anticipating that in one of the state calls soon, I'm hoping they will address how they'll, if they're including the third booster category in the data, or what, because I think now the second booster data has gotten a little bit messy.
That seems a bit confusing.
Yeah. So hopefully they'll address it. Usually takes them, I find it takes a lot of the local or public health people often have to inform them, hey, this has come up for us, how do we monitor this? And then they'll address it at one of their state calls.
I'm just thinking of, you think, well, second boost, no, wait a minute. I know, third line, triple boost. I don't think it's that booster. Okay, thank you very much. Any other comments on any of this one?
Oh, yeah, I don't think I need to really go into anything else for my technology update. I mostly wanted to talk about how we don't that. So.
Okay, very good. And I guess we're into public health nursing. Anna, Mary.
Sure, I can go. So we have started the school clinics and urban clinics. We had one at the CAP, but the computers failed us, which made it a little bit, hopefully not too chaotic, but we got everybody vaccinated. We did one walking at the harvest fair, which was surprisingly well attended, regardless of the wind there. We're having another one tomorrow here for both flu and COVID. And then we're trying to find a date just during the daytime, just for peds. For younger kids, we have some per diem pediatric nurses that are willing to come in for a couple hours, and we could just target the under school age ones. We understood there is a Melpits is doing a flu clinic at Pollard on Saturday that I guess fully booked. So hopefully we're getting a lot of the younger ones well between the two of us. There has been a large uptick on the gift of warm requests in the past month. There were 9. It was up from 4 the previous month, and then there's quite a few for this month already. I think there's with the rise in energy prices, we're expecting to see more and more or hear more and more from residents about this. We recently sat down with Lynn and our nursing department to try to create a policy on how we go about administering the gift of warm, just because it is meant to be a one-time assistance, but it seems that for many it's not enough. And really trying to help everybody get signed up who qualifies for the self-help program, the federal program, and kind of making it, if you qualify, we'll help you get the application in, but you have to do this in order to come back to us, because we don't want to be the one that they easily come and get the assistance from if there's other resources that they could be applying to as well. And then what else? There are more of the youth sports organizations that are starting to run programs again in Eden since the pandemic. So we did another education on the Article 24 about the concussion prevention. So doing that. And we are done with our trainer for the domestic violence abuse thing. And now our goal is to go to the communities, to different organizations and go and talk about TVAC, what we do, the resources that we offer, and the resources that we can connect those who are impacted by domestic violence. That's kind of that.
I have a couple of questions.
Yeah.
One is about the Vibrio case in September.
I hope Mary is on.
I am. So the Vibrio case was actually very weird. It was cultured from an ear infection. I don't have much more to say about it because I didn't know that was a thing. I had a long chat with Julie. So the individual I spoke to was just as surprised that that's what it cultured out. But yeah, it was an ear culture. It was the Vibrio.
And they didn't get it down to the species, just.
Yeah, no, they did not. It just said Vibrio species. Probably because it was an ear culture.
Oh, the other one is Hep B.
Oh yeah.
Mary.
This is contact.
Yeah, it was being followed by the state. So I wasn't given any information about it, but there was one.
Oh, okay. Very good. And I have one more question about gift of warm. What is your demographics like? Who's applying? What age groups?
You know, it's a lot of seniors. They always start, I'm a long time resident of Needham on fixed income. And then there are also what appears to be like 30s to 40s single moms with children who have medical issues.
High proportion in Needham housing. And then, yeah, a higher proportion seem to be on, have one or more disabilities. And so we're also doing a lot of counseling in terms of talking to their doctors to get notes in that sense. Or one individual I talked to was getting a letter from their doctor for their child to get the electricity kept on for that. As a side note, I kind of went through historically the next highest month we've ever had in terms of dollar value didn't break 2,500. So we did $1,000 more than historically I could find us ever having done in the past in a single month. And I didn't ever see that we'd done more than 5 or so people in a month before. So September was, it was a historic high and not even just a trending up kind of thing. I don't think we've had a month as heavy as September in the records that I have.
Right now, we're comfortable with the balance we have in the gift to warmth account, but right now, or at least over the last 12 to 18 months, $10 go out for every dollar that comes in. So that obviously is not sustainable in the long term.
Yeah, which was the next question. It's going to be resources that support this.
Yeah, so I'm not entirely sure how much is there right now dollar-wise, but
$48,023.19.
Yeah, I got a somebody connected email to me from a local faith organization and was asking how we run the program and how is it funded by town or in addition to donations, is it funded by town? And said that they're thinking of making a sizable donation. And so I replied to that, but I have not heard back since then.
And so one of the things we always we have some flexibility with gift of warmth because we're not using town dollars. It's not appropriate to use town of Newton taxpayer dollars to pay an individual's utility bill. So it's all donations. We have some money from the town, it's a very modest amount that we can use for things like a hoarding situation and we need to get a dumpster, or a loved one died and there were a number of needles that were in their home that were not properly handled or disposed of. Those are instances where we can use some town dollars, but we can never use town dollars to pay someone's utility bill. It's always donation.
Sorry, I was just going to say that.
I'm just thinking this population that you're talking about is at higher risk for trying to keep their homes with their ovens. And we don't want to have the CO poisoning, and gas prices are expected to go up about 60% this winter. Is there any way that we can make sure that they actually have? I mean, yes, it's the law that they're supposed to have CO detectors in their homes, but do they actually have them? And is there some way of linking these two programs together such that if we're giving them something from the gift of warmth, then we somehow make sure that they actually have appropriate smoke and CO detectors in their homes?
We can look into it. I don't know.
We can definitely ask that question because we ask them multiple questions anyway, and it's always a conversation because there's also the education piece on how to. I think that just from what we're hearing is people are having difficulty adjusting to the changing environment in regard to inflation. And it's difficult to think that, oh, because this is happening and everything costing more and I don't have more income coming in, I have to make changes somewhere. So there's always that part of the conversation that happens. So we can certainly add and ask just like, hey, do you have?
Can I just point out that this isn't even a heating month. This is a shoulder season month. And so I don't know how we promote this program, but I know with the pandemic, we've raised all kinds of funds in places. I don't know what else we could be doing to increase this pool, but I think the demand is going to really jump. So just my thought.
There was a lot of people coming in September also who were getting their shutoff notices ahead of, the higher rates that they saw in July. And so they got behind in July and then they were starting to get their shutoff notices in September. The upside is, I believe it's October 12th. I think we just passed it in terms of not getting shut off in the winter. And so, you know, we had another small rush, or the rush kind of continued through the first weeks of October as people were still kind of dealing with not getting shut off. And so, yes, it's a shoulder month in the sense that everybody's bills are a little bit lower, but in terms of catching up to the July bills and still being in that shut off window, September is a pretty good month for, you know, for getting requests for help from Gift of Warmth.
So last year, many of us here, Just Moss, started a homelessness task force. And in response to families that need temporary vouchers for hotels, or started with moms with children and the domestic violence incidences. So on the town website, Tim had Sarah write up, we decided in addition to Gift of Warmth, in a more general way, we needed a fund that people could donate to, and it's Crisis Support Donation Fund, and it's on the town website. And a need that might come up through CCIT or the Youth Resource Network for families in need. And finally, there's an online donation button. So that's a program that I think many people don't know about. And the oftentimes you see it on Needham Facebook that they're looking for a place to donate in the 200 Women Needham group. I may be saying that wrong, has featured this. So this is another program that the town has put together through the town website, Crisis Support Donation Fund. And you can find that and maybe just know it's another pool of money. I don't know how much money is in there, and it's that same criteria that you.
Last I checked, under 4,000.
So we may be able to promote that too. And I just wanted to point that out.
Yeah, I mean, I wonder if the Gift of Warmth piece, I mean, it sounds like a church or somebody reached out to you, but, you know, is there more promotion that could be done to the residents of the town around donating? I wasn't aware of it till.
So I think one of the challenges we have, certainly we can publicize that there is a link, absolutely. Town employees cannot ask for donations. So, you know, one of the things we potentially have to talk about is who can ask for donations, or who can, if the public health department staff can tell you and inform you and educate you about the program, who can do the actual, and would you contribute? There is a group called the Friends of Needham Health and Traveling Meals that are very committed volunteers, but the fundraising is limited. They almost 99% of what they do is related to helping the people who can't pay for traveling meals to pay for the traveling meals. So there's not really any resources that are untapped there.
Question. Can Board of Health ask for donations? They're not town employees. Okay. That's a possibility. All right, very good. Any other comments?
Just one quick thing on communicable disease. I think we should add monkeypox to the list. Just it's certainly potentially becoming a pandemic. It's just be on our list.
I can't hear, sorry.
I'm saying, I'm suggesting that we add monkeypox to the list of communicable diseases that we track.
Well,
we're gonna get kids anyway.
We haven't had any yet, so it's not on there. But until we've had 5, we're only really allowed to say whether or not we've had any. And so since we hadn't had any yet, I hadn't put it on there. But because of how limited it is, you know, we're not allowed to report that we had 1 or 2 or whatever. It's just yes or no until it's more than 5, I believe. So we have not yet had any monkeypox cases.
Okay.
Comments? Any more comments? Thank you. We'll move on to emergency preparedness. Tiffany, please.
Good morning. September was emergency preparedness month. and we took the opportunity to reach out to our volunteers and share with them source how to prepare themselves, their families, neighbors, friends. And I think it works because according to FEMA survey 2020, it's 68% of Americans become more prepared because of, I mean, they answer survey questions. 65% of them, they have prepared because they receive information about preparedness. Second, it's we coordinate with the nurse unit to assist them with the vaccine clinic and reach out to nursing volunteers to get non-medical and medical volunteers to help us. Third, we over the month of September, we was working on preparing for to participate at the Harvest Fair, and it was great. For example, we reached to FEMA warehouse. We ordered activity books for kids. So I mean, we ran out of them because lots of kids they pick them up, so they can practice. They color in the activity books and why they learn about the emergency preparedness. Regarding the accreditation, I am assisting Tiffany working on domain 2, which is talk about emergency preparedness and response. And I submit, I review the COOP, the Continuity of Operation Plan for Native Public Health, and I add my notes to that, and I submit it to my management so they can review it, and after that we can share it.
Thank you. Questions?
If you have any questions.
Thank you for being the Harvest Fair.
Yeah.
Okay. We are now up to emergency management.
Good morning, everyone. So in September, we conducted our EOC training for the town's Emergency Operations Center. So that was refresher training for people who have been in the EOC before. And also we had a few new staff members added this year. So it was initial training for them. And then actually this month, MEMO held a more advanced Emergency Operations Center course in Needham that several of the EOC members from the town were able to get to, which was great. I thought that was a great class. We've also kicked off our planning for our joint tabletop exercise with Jackson, Olin, and Wellesley, town of Wellesley. So the Mass Maritime students that we're working with, they were super excited, and they've taken our outline of what we want to see from that tabletop exercise and run with it. So we expect to have that ready hopefully by early November at the latest. It's due for them as further coursework at the end of November, and then we'll host the tabletop exercise in the spring. And then we got our annual notice of funding opportunity from MEMA for the Emergency Management Performance Grant. So talk with Tim and Chief Conroy. I think we're gonna have the application drafted. We want to get a consultant or contractor in to help us write a shelter plan for the town. As we talked about at previous meetings, our hazard and vulnerability assessment sort of caused us to re-emphasize our sheltering and what we have currently in terms of plans. I haven't been able to find a plan on the drive. I think we might have some old hard copy plans, but so this would be a fairly useful, beneficial use of the grant fund for that.
Thank you. Thank you. Comments?
Any lessons from Hurricane Ian or anything that you sort of think are relevant to our town?
I think one of the things that has definitely come up with that is that people weren't following their plans. I think that's one of the things that has come up, that there were delayed evacuations and stuff. So I think making sure that people who are actually performing functions in the Emergency Operations Center or something, actually understand what the plan is and to follow their checklists for, you know, liability reasons and stuff, more than anything.
Okay. Very good. Next thing is shared services grants. Diana, I guess.
Yep. Hello. So in September was a pretty busy month. I'll continue doing a lot of training. So I attended the DEP drinking water seminar. Roland and Jess, who are the part-time health agents under the grant, attended the Yankee conference and did the lead determinator course. We're still waiting to hear back for the results of that, but I'm sure they did great. We all attended the FDA retail food protection seminar, which was also held virtually. Jess Kent is moving forward with her REHS training, and she completed and passed her certified pool operator certification. Roland helped out with some inspections in Needham and in Medfield this past month. So he helped Allie with the Charles River Landing inspection and follow-up. And he attended Medfield Day with Bridget Sweet, who is the health agent in Medfield. They went around checking the food stands, which is, Medfield Day was kind of like the harvest fair, but in Medfield. So the biggest thing, like we had discussed earlier, was the capacity assessment. That's the biggest thing that was going on in September. Tim and I are continuing meeting with Reagan Cecchio of Regina Villa. So we're still discussing our strategic planning plan to determine the next steps to continue to develop the Charles River Public Health District's intermunicipal agreement. So we're still in the beginning stages of that, and I'll give more updates as we flesh it out a little bit more. But we're trying to figure out the best way to present our district to each town, again, to Dover and Medfield and Needham, and try to create some sort of strategy where we can come to an agreement of how we are going to move forward and continue sharing services. The Purple Air sensor project, we got 2 more sensors in operation at Pollard Middle School, which is great. And then contact tracing is still moving forward as normal. Michaela and Kendi are still working on cases in Medfield and Dover. Cases have been going down as of recent. But now, instead of following up with voicemails and having to talk to the people, they're still continuing leaving one voicemail, but also sending out a text message with all of the current isolation guidance. Are there any questions for me?
Doesn't look like it. Thank you.
Welcome.
We're to the traveling meals program.
Rebecca had to go to the hospital to help with deliveries. So,
yeah, I mean, she didn't really have any updates as far as meal deliveries go, but she's still going forward with the program. I know Tim's working with the idea to try to set the contract, but she's keeping everything steady as far as we figure that out. So
yeah. I don't want to dwell on it, but that is a big concern of ours. The hospital saying they don't or can't participate as the provider traveling meals anymore, and what that means for the future of the program. Finding another vendor is very challenging with the price of food being so volatile, and with hiring for hourly staff being very challenging. But it's also the case that the town can't set up its own operation. If indeed it wants to and thinks that's a financially appropriate thing to do, it can't set up that overnight. So very challenging.
This is where potential renovations to the Cath kitchen come in. Potentially, but that would cost quite a lot of money, which we need to get, and then they need to be done. And there's supply chain challenges for a lot of equipment. And then we have to figure out, is it a financially sustainable model to staff that and run that food service operation? How do other towns that are doing that? I know they do some big.
There's only a handful that run a full food service operation. Yeah. And I've actually asked a staff member and a former board member, former staff member up at Aging Services to help do some research on that. Franklin is one, Northborough is another that have a really full service food operation out of their senior center.
So there is a town that's doing it out of this.
Yeah, there's a couple others too, but those are the two most prominent ones I know of. How they're, how the money works, how it balances, I don't know.
Do we have any influence with BI Needham? And I ask that just because I know, Marianne Cooley is on their board of advisors and things like that. I don't know if there's other avenues of influence that we could try to use.
We're going to try to do that. I think that could buy us time. I think the fundamentals still won't change. So, people further up the totem pole can say you have to make this work, and the people lower in the totem pole will try, but not having enough staff, the price of food being really expensive, and us being their third or fourth priority isn't going to change. So, long term, it's not the right solution. Could it be a stopgap for a year and a half? I'd really love that. That would be great.
The alternative is just, this program would go away. That'd be a disaster.
Well, so I think the town manager and the select board probably need to hear that. I think it's a very important program. It is serving incredibly vulnerable people in Needham. But there's a small number.
It's not the profit status, they are obliged to provide some relief.
Yes.
Select board might be the ones to provide that.
Yes.
I didn't hear that.
Basically, they're tax exempt.
I didn't hear it.
The hospital is tax exempt, and as a result, Massachusetts law requires them to provide community benefits, which is one of the community benefits they cite quite frequently, is that they produce the Traveling Meals program for way below cost.
Thanks.
How long is the hospital?
Since the hospital was part of the town, 52 years, 52 years? Yeah, 52 years. Long time.
That's even before I okay. And our numbers this month, the past couple of months have been considerably higher than last year. So
yeah.
So
I do think we have some questions, and we sort of have to get a resolution soon. If we don't think there's a future for the program, it's irresponsible to take on new clients. It's also inappropriate to keep refusing clients if we think we can run the program. So we really need to have a sense in the next 6 weeks of what we could do.
maybe we need to develop a strategy, put some pressure on that. And I think the selectmen might be the way to do that. May not make this too popular with the hospital.
Is this something that the town is aware of? Just the community, just publicizing the fact that this program may go away.
Yeah, I'm trying to figure out, when to quietly exert pressure and when to publicly exert pressure. I think the hope is that we could use, gentle persuasion to say, you really can't tell us we need to go with 3 months notice for the government. It takes us a long time to do something. You got to give us 18 months or 15 months or something. And the challenge is I need to have a realistic sense that I can come to some other resolution within those 18 months, because renovating a town building and hiring a ton of staff is very challenging and very time consuming, but so is finding someone else to provide it. I mean, realistically, with food safety, you're talking about someone that is either in Needham, a facility that's in Needham, or very close to the town border. You're talking about an institution that could produce meals, at a modest cost. So right now, the director of school nutrition says it costs about $4.50 to produce a meal, not including packaging. So the hospital is giving us, depending on how you count it, a $9.50 or a $10 value for $6. So could we pay more? Yes, but we're still probably looking at someone who's willing to take a loss of $1 or $2 or $3 on every meal they produce for us. So it really has to be someone who has some charitable purpose, or someone who's really bad at business, I guess. But is also very wealthy, so we'll see how those two square.
Yeah, Clergy Association is also.
Yeah. And I'll drop little comments here and there to the right people.
Yeah,
what might happen. Okay. Accreditation team report.
Lynn has a conflict, City Martin.
Okay.
We are still chipping away at the various requirements along with other people across the division. And we talked last time about our timeline. And Lynn is working diligently right now on putting together all senior assessment results. So I would anticipate probably in the next meeting or two, we'll be able to present the results of the senior assessment to you all, which is part of the broader community health assessment. We are working on performance management and quality improvement, looking at projects that we use as examples to set up procedures for that, and we do staff training across the division for that as well. We're focused on developing a workforce plan in the next couple of months and continuously reviewing policies and procedures so that we can have the appropriate action. So have a few different streams going and hopefully stay our timeline and across the entire division to put everything together.
I'm a little bit close to the end of our time here. So we have environmental health report.
I could start off just a couple updates on staffing. So who's been our unpaid summer intern, has accepted a paid intern position. So he'll be helping us with till the end of the year, all of the FDA grant funding money, as well as the town operating budget money to go forward with the FDA initiatives for the grant, which will include helping us with the food advisory board, the trainings, and also the restaurant grading toolkit. So we'll be going forward with that. He's also agreed to stick with us for next year as well to focus on the grading project as part of the capstone master's degree program initiative. So we're happy about that. He's like, I'll do it paid, run paid, whatever. So we wrote him into our grant. We did apply for the FDA grant again. It was due yesterday. We got everything in on time. So we're hoping to get funding for that as well. So that will give us more ability to go forward with those initiatives. So we're happy about that. The other update I can give is on the pest control. I know we have a pest control piece on our upcoming, but I can give a touch update on this one as far as the items in town where we're currently treating. So as of yesterday, we've been working with Keolis and BTA on a couple of hot areas in town. You may have read about them on the report. So there's an area right behind Hungry Coyote, Duncan's, Sudbury Farms along the tracks, which we found a lot of rodent activity back there. So yesterday we were able to go out and treat A1 pests. So again, it's a collaboration between the restaurants and Keolis, and they're working with A1 pests to treat those harborage areas. So they did perform a treatment there yesterday, and then they also treated it behind 7-Eleven in the Heights area. So that was another hot area. So it's been a valiant effort between Allie and I in getting the coordination between Keolis and the restaurants and retail stores to go forward with those treatments. There is one other area in town at the end of Reservoir that we're trying to work with the state. So the state was able to work with us along the highway area. There's a little catch area, rubbish and trash, which they did come out and clean that. But now we're at the point where we need to have someone treat that area. State has told us that they don't feel they're responsible for treating that. We found that out recently. So we have to come up with a plan how that's going to be treated as far as those rodent harborage areas. So that's to be determined. So that's our next step as far as the active areas in town for pest control. So
okay. What about the butters?
What's that? The butters. So Forklift Catering is in the reservoir area. They have been really great about doing their ongoing pest control, and they actually don't have any evidence of pest control in any of their areas. They have a composting area over there, which is clean. They've kept it very neat, clean, and contained. So they haven't been any evidence of any rodent activity in their area. So it's literally around the highway. And there's a little catch there between the barrier and there's fencing, and there's all trash debris up around that area. We also have the repair shop across the street from Forklift clean up their area because they have a lot of clutter and equipment, machinery, and things like that, which they did a phenomenal job cleaning up the area. They have also contracted with the pest control to get on top of that piece. So it's really just getting the activity along the highway.
Yeah, because
treated.
We don't treat that, or so nobody treats it. It's just,
yeah,
source for to go right back.
Correct. So we just found that last week. We want to exhaust that piece first before we went forward, going forward, how we're going to treat that. So we'll look at how we can fund that coming up. So.
State.
Correct. I mean, for them to say that wasn't really caused by us. Well, the trash didn't go that by us. I mean, they should be maintaining that strip, which we're reminded. He's like, well, we didn't even realize that was that bad. Well, yeah, we got them involved with that. So I'll work on them a little bit more about putting pressure on that piece, but that was going to be the next step to focus on that area. So I don't know if Allie, you want to have a couple of updates as well?
Sure. I will add, we've been working closely with the Needham Housing Authority to close out a lot of cases that just have been pending for a long time, that we've really had issues with them making progress. But finally, I feel like we have a good system going. So I've been meeting with NADA, who is one of their staff members who works closely with the residents. And we plan a time to go out and we go to the property. I do an inspection with her, and then she writes out on her work order anything that they need fixed. So we can finally close out these pending cases. And it's been working. And the follow-up is good, because sometimes we follow up and she said, oh, I thought you got a dehumidifier, and then there was a miscommunication. And so it just kind of keeps them accountable. So that's been working well. So I'll add that.
That's it.
Yeah, I think those are the
Anybody have any comments on any of the other items? Have we heard anything from Rice Park?
No, we haven't. So that's pretty quiet. He tells us when he's entering. So that's not.
Very good. Then we move on to the other update, pest control.
So again, this is in reference to Kathleen. You had sent an email to us in reference to your pest updates. We didn't get to it last month, but you had updates about mosquito and tick control.
Yeah, I mean, it's a little bit gone by, but like where there are places that store tires outside, they should be covering those all year round, really. But in the summer, I guess was the thought. And I wasn't sure who was, is that in our purview? I think it is. So one of the residents had observed that, and that was sort of in the drought period, and then we got the rain, so it's a little bit after the fact. But to get that on our radar for next year, it would be something. There aren't that many, I guess, places that would store tires outside, but it would be good to check on that. Does that make sense?
Probably just the general notice to them.
Sorry, I didn't hear that. Could you say that again?
Yeah, general notice to any place where that stores tires, about how to properly do it, cover them.
Yeah.
Sort of
Because we wouldn't otherwise license. We wouldn't inspect like an auto body or a gas station other than food, right?
Correct. Yeah, I mean, we normally would follow up on any complaints we received from them. Like we've gotten auto body complaints in reference to odors. And we've actually had some reports on tires not being stored properly that hold water. So that has come about as a complaint came in, but we can definitely get a list together and send a letter out or emails out to those that we're aware of.
Yeah, it's not a bad idea just to get ahead of it, at least next year. Thanks. I think we all, and then there was also outdoor dining. We're getting to that, right?
Yeah.
Yeah, go ahead.
No, I mean, it's an issue, right? The types of trash cans we have, food, it's one thing to do CO treatment, but, getting rid of the food source is the primary. And I was just going to follow up also on the highway issue. Like, this must be an issue all along the highways through the whole state. Like, I mean, isn't Newton having the same problem in places? Like, why are we unique? Are folks noticed? Like, I don't know, it seems like a regional problem, but of course we don't do anything regionally, so it complicates things.
Yeah, Borkwood Catering was the person who came to us saying, hey, we know there's pest activity, there's holes right around here, and we don't want them to come into our restaurant or our catering facility. That's how it all came about.
Yeah.
When we do our inspections, we inspect his trash, his compost. If we don't see evidence of pests, we don't really investigate further. But he pointed out to our inspector, like, look at these holes along the highway. I don't want these pests getting into my store.
Yeah.
That's how that came about.
Mm-hmm. Yeah. So I guess, you know, it's the same problem in other places too, but it seems like, you know, I don't know how we address it, but other communities must have similar issues, right? And this has become a real regional problem, right? The rats, will just say it, in the suburbs. And so I don't know if there's any movement to sort of work. I know it is small problems, but they all build up into a big problem. But like the outdoor dining, and you have to have it be accessible. So you have those, you know, like boardwalk type setups. I mean, there just has to be tons of food under there, wherever those are. And then the types of trash cans we have too are kind of open, right? That anybody, you know, animals can climb in the top. So things like that. I mean, just planning you know, we're redoing the common, like, let's not do more of that. Let's probably try to have better trash management there.
Yes.
Yeah, I can follow up. I mean, that's a DPW. They're the ones permitting and constructing, but we can follow up to see what type of trash management with the common redesign.
We are looking to develop a protocol as far as, you know, Brookline has a protocol. I think Dedham might have a protocol, but we're looking to have something that works in Needham for outdoor dining. So that is something that Ally and I are investigating with other town regulations, what requirements they have. So that will be another piece that we're going to be.
And that's why you put
drafting. Correct. Yeah, but Brookline and Dedham have had issues, correct? Pest control, because they have a raised decks type example that in Dedham, especially where Needham wants to do the similar type of proposal to have, you know, handicapped accessibility. So over the parklet, they would have a plastic deck or something that goes flush with the sidewalk. So they're finding that underneath these decks, the little harborage areas, they're not getting cleaned and maintained, and leaf debris and food debris. So this is why we're looking to write a policy for, you know, addressing those types of things.
There needs to be access to it, where it needs to be something that food can't get down to.
Correct. I would prefer, and I think it was on the same page, that they could have it just on the pavement, but have like a ramp for handicap. So that way there's no catch-all for these debris to get in there, because we know those are perfect harborage areas. We've seen it everywhere. So that's just one of the suggestions I had made, to have them flush with the ground, have a deck for handicap accessibility. That way they can, you know, clean that area, the parklet area, no problem.
Right.
And that would eliminate that risk of traffic pests. So.
Boston has some problems with that. You have to Center Street. Okay. Moving on to court-appointed receiver program.
Yeah, so I think this was just a brief update from Tara and the environmental health team of the successful resolution of the longstanding issue. Tara, well, I should say the environmental health team, and works closely with the building department. And then when there are properties that meet certain thresholds, does involve the state attorney general's office. Often these are abandoned properties or properties that are in, the title is in dispute between people who believe they inherited it, but conditions are such that it becomes a health impact to the neighborhood. So I just wanted to include it. It does represent a lot of work. to get to the point where we then involve the Attorney General office. And then it becomes quite a lot of work still. But Tara and Dave Roach have used this process for 5 years.
Yeah.
With some pretty successful results.
Yeah, so we've had a collaborative relationship with the Attorney General and taking care of some of these vacant properties in Needham that are just sitting. So it helps.
I'm familiar with this one.
Yeah, so it does help us kind of get that completed and moving in that right direction. So we did have that happen with this Linden Street vacant property recently, and at the hearing, the judge had appointed receivership to take care of that property. So that would be the next step for this property. But yeah, they reach out to us maybe once a year. They reach out to Dave Roach and I. Do you have any vacant properties that you need help with? You know, we're here to assist you. So they've been great with helping us with those.
Now we come to the Blackstone Field, isn't it?
Yes, so this is an issue that we had started to bring up briefly last month. We were waiting on a couple different memos, one of which came in yesterday at about 4:30 p.m. I did a very brief summary memo for the board, but the long and the short of it is the town was preparing to do sort of a redesign, refurbishment of Blackstone Field, specifically the softball playing fields, and installing lights. They were doing test borings for lights, which would obviously have to be, drilled down and installed pretty deep. In doing so, and they were aware, the town is aware that that used to be, when it was the dump, it used to be a burn area. The borings revealed that there is still, substantial, visually revealed, there's still substantial material, including metal fragments, ceramic, glass, etc., consistent with a burn area, but that the level of fill above it is not consistent. In some cases, it was 12 inches deep. In other cases, it was as low as 4 inches deep. The town decided to take down the playground facility because that was maybe the most immediate concern. If there was only a certain amount of fill above the playground, little kids might dig, so that was why that happened. While the town was trying to figure out what it was going to do and how it was going to address the situation, the contractor who's doing an extensive water and sewer line replacement on Central Ave approached, approached the Park and Rec commissioners and said, we've got huge pipes, we've got big equipment. Can we use this field that is out of commission now as a laydown space? The Park and Rec Commission said yes. The contractor exceeded their scope, and in an effort, I think, to be nice to the town, and said, we're going to scrape up basically the first layer. We're going to put down gravel. We're going to lay our stuff there. And when we're done, we'll take all that away. We'll put the fill that we moved off to the side, and we'll level everything out and make it nice and smooth. In so doing, they removed most, but not all, of the topsoil that was covering basically the burn area underneath. The issue was brought to our concern by a resident. You can see her email to Tara from the end of August. And we looked into it, we investigated, we got Maggie, the resident, who actually provided us with the first memo, which we hadn't seen. That's the memo from January 27th, 2022. There's subsequent memos that we got on September 22nd, which was our effort to start investigating what was going on based on what we were now notified of. And you can see that along with some of the site conditions in photographs. And then the memo yesterday, which I think was, at least for me, the most helpful, which is a brief summary, but a series of recommendations on how to proceed. Massachusetts has, and I'm not an expert in it by any stretch of the imagination, and Kathleen, you are more an expert than I am, but the Massachusetts contingency plan has a process when there's environmental contamination on site. And it relates to spills, but it also relates to removal of potentially contaminated materials from a location. In this instance, it wasn't triggered because none of the materials were moved off of the site. They were piled in one area. But the recommendations, I think, are to try to address the concern of, what is under the soil if or when, when the construction project is done later this fall. How do we return the fields and conditions into something that is safe to use? The town is in the midst of negotiations with the construction company that again exceeded their scope in an effort to try to be nice to the town and return a nice sort of completely level area. But the town is going to work to require some sort of mitigation from the contractor. So the recommendations that were included in the email the memo yesterday, I think are helpful. As are, so particularly the last one, following return of the soil, place an additional amount of fill and loam on top of it.
My question is that enough? And it seems to apply to some of their other demos that have been 12 inches. What's necessary when you're capping the site? Yeah. And now you basically have this mix of contaminated and non-contaminated, which means it's contaminated fill that they're going to put on. Now they're talking about only putting 6 inches on top of it. Might not be enough.
Okay. I think the contention by the contractor is that they never quite got to the contaminated soil. They just took almost everything that was on top of it off.
I don't even know that.
I think that is a fair question, and I think it's probably true for the most part, but is it true everywhere? I don't know.
That's the issue, right? Because it varies
uneven
on the topsoil vary considerably based on the earlier investigation.
Yeah. They did note in the memo that there is in the topsoil, and I think they said something like less than 5%, but you could visually see bits of glass, bits of ceramic, bits of metal. So some amount of contaminated area was in the topsoil that was removed. The consultant thinks it's a small amount, but that's still some.
I think another question would be, what kind of like heavy metals are we talking about? Particularly lead. Just in those days, people took everything up to the dump and threw it in and burned it. And I would bet there were plenty of paint cans that went in there. And in those days, they used lead paint. Mm-hmm.
So I think
maybe you might want to know that. I'd be less concerned about pesticides because that was also pre-pesticide, but it wasn't as widespread as it back then.
So I think, and Kathleen, I don't know if you want to weigh in specifically on the MCP. I think the MCP gives the town some guidance, and I think it's hard to sort of articulate this clearly, but it also lets the town know which steps would trigger significant reporting and remediation responsibilities that would run into the many millions of dollars and the time frame of half a decade or more. I think the town's position is that it needs to make sure that the playing area is safe, but that it desperately wants to avoid taking a playing field out of service for that length of time if we can put in mitigation steps that will make it safe.
Well, it would be nice if they had started this process with us in January, that that letter is a smoking gun. When they said, oh, we didn't do technical analysis, therefore you don't have to report this to the Department of Environmental Protection. Let's do everything we can to prevent that.
Yeah, that's a rather dangerous.
It's like we knew it was dangerous. We decided not to investigate it further, lest we, actually have to do something about it. That's the January letter, basically.
I mean, the problem was that when they closed that dump and covered it, there were no standards. Yes, at the time, they would just throw some soil on top of it, walk away from it. Now it's a whole process. Cap the dump.
Yep.
Well, I don't think whenever you redevelop a field, you go take samples. I think the fix is the same. You put clean soil on top of it for the most part, right? So I think there's the short term and the long term. The short term is that they should have been storing this they shouldn't have scraped off the top, right? I mean, but whatever's exposed should have been covered or wetted down, you know, continually wetted down, these sort of construction mitigation. And then long-term, putting clean fill on things that aren't mobile, like lead and PAHs, makes sense. So you know, to cover. So I think that the idea of the MCP is to not have all these sites all around the state that are undevelopable because somebody found something that isn't going to move through the soil. And so now we're digging up, you know, inches of dirt and trucking it off to an asphalt batching plant that then will go pave your road. So unless I'm missing, you know, I am not an expert in this field. I have worked on some projects, but that is my understanding of the purpose of the MCP. And it appears that they're meeting the requirements. So, but it, you know.
If I'm reading this correctly, you know, I'm working backwards from page 2 on that first memo in January where they talked about this process. But basically, a contingency plan happens after Mass DEP releases, gives you a release tracking number. So basically, this implies that Mass DEP will be involved in this process if we're actually following Massachusetts contingency plan or an MCP. Or is the intent here that no, we're not going to report it, but we're going to kind of follow what we think their guidance would be?
So it is, we are well aware of the triggers and we have not actually triggered the MCP, but that was intentional. And the town is looking to put in mitigation steps similar to what would be recommended in many types of situations. But that the town is also trying to balance cost, time, and access to playing fields.
I understand that, but if something happens out there and we let this go, it's going to come back and bite us. And I'm not sure that that's a good strategy.
Yeah, I think there was more material in one of our previous packets saying that you need to have like a foot of topsoil. I'm not seeing it here.
Really?
Yeah.
I mean, I think this is almost a replay of the daycare center down the street.
I don't know what the appropriate number is. I mean, I don't know if 6 inches, you know, 6 inches to fill or what have you. But you know, if we're going to cap it, we need to make sure we're capping it right.
So I think that there are, you know, maybe as Kathleen alluded to, there's sort of two points. What is the short-term steps that can be taken or are being taken to make sure that any amount of contaminated soil is not moved off site, is not tracked off site, is not blown off site. And then the longer term is what is the permanent solution to try to return the playing field to safe and good working order.
I think at this point, anything that the contaminated soil is back piled up now, it has to go back because you got to deal with it. But then anything that's done to remediate the problem is going to be 6 to 12 inches on top of that.
Yes.
The other thing is, do you want to get a second opinion? I mean, you've got a memo here with recommendations from the same engineering company that said, oh, let's not report this back in January. I mean, I see an inherent conflict of interest here.
Yeah.
Now, they may be right, which is fine, but we may just want to get an independent opinion.
Okay.
The other question I have is, you know, there's activities that happen in the Blackstone parking lot. And I don't have a good sense, and they're talking about cleaning trucks that are coming out of the area and all this sort of stuff. But, you know, is that an area that should be being used for, you know, car washes and other stuff that the high school kids have been doing and so forth?
So I'm certainly not an expert, although I think the primary concern is direct physical exposure. It's not, you know, it's not proximity. Like, so if there's a pile of material that's potentially contaminated over here and you're 100 yards away in the parking lot, I don't think we're too worried about you. We're worried about that pile being moved or being blown.
I'm just thinking if it's blowing to the parking lot, or, you know, if the trucks are bringing the dirt to the parking lot where the kids are washing cars and stuff.
Yeah,
just asking the question.
Right.
Yeah, the same with dust and thermal content, it's what engineers are saying, right? That's what they want to mitigate.
Yep.
So, you know, if this aerosolizes, if you breathe it, it's not healthy for you.
I mean, I think, yeah, we need to mitigate that right now. So yeah, okay, that part of the plan is fine. But then what are we going to do after that? Right. Judging by how fast they're doing the work on the road, it's probably going to be going up forever anyway.
Sure. So I think I will try to get some additional info. I'll investigate the option of getting a second opinion. I will tell the board that one of the challenges we're having in the public health department is capacity to do financial project management. So the time it takes to do competitive procurements, the time it takes to develop scopes of work, that is not very interesting stuff, but we have a limited capacity to move things through. But we will work on getting a second opinion, and we'll work on ascertaining the recommendations are in the memo from just yesterday, but how many of them have already been implemented, and if they haven't, why not, and when will they be? And then a little bit more towards the longer term question of, okay, what is the long-term plan to return it to a safe working order? And is that a appropriate and sufficient plan?
Yeah.
So the immediate risk mitigation should just be happening now, while we're even thinking about a second opinion and so forth, right? Like in terms of putting the fencing up and covering the area and all that they're talking about.
So I don't know how much of that has happened yet, because I got that yesterday at 4:30.
Right, no, understood, but the plan should
that
be
seems
that
like
it's
the type of, to me, I'm not an expert in construction, but those seem like simple, relatively simple things to do, right?
Those seem to be reasonable.
Yes.
At this point.
So I will get an answer to that of like, have they happened yet? If not, by when are they happening? And then ask for figure out how we can try to get a second opinion. And third, pursue answers about what's the long-term plan to make this safe.
I'd like the question about, you know, should we be using that parking lot also addressed?
Okay.
Which, I mean, it's probably going to get used less as it gets colder because these outdoor activities are phasing out, but.
There's a problem walked out through the using that one.
They were doing.
Yeah, they driven by there a couple of times.
They didn't use that.
But even up into the winter, they do the Christmas tree set.
Right.
Right. Well, that's
not necessarily the parking lot, but there's still people there. That's when.
That's one of the recommendations.
It's the recommendation to cover up the fence around the area, start not doing more work there.
And we probably don't want people holding their political signs, you know, across the street from the transfer station right there, which is a popular activity this time of year.
Sure. Okay, so I think I have my marching orders from that.
Did you say you had a hard deadline on leaving?
I did, but I moved it once I knew we were going to go over.
Okay.
I do need to leave in 10 minutes max.
Okay. We have some of the short items here, I think. So we need to, there was a discussion about having a regular Board of Health meeting schedule, similar to what the selectmen do, just like the board does. They just meet every Tuesday night at 6 o'clock, and then somebody can't be there, they can't be there. Instead of having our meeting rotating days at time, that this is the day and the time.
I know the problem with that is just you got to set it well in advance.
Sure.
I mean, right now, I'm putting in, you know, my schedule for March.
Yeah.
Right. But if I said, you know, from like, you know, April 1st on, this is it. You know, then it's just, well,
start at the beginning of the next fiscal year.
I do travel a decent amount. It's very irregular, so it just would mean that, you know, I may have to miss the meetings or call in from God knows where I would be, but I'm fine with doing it. It just, you know, can't guarantee I can make them all for sure.
Right, as long as remote participation is okay. So travel. And then the only other thing about keeping it at one particular time is that we've talked about just access for public comment that can't always come to, you know, come to tonight at 16.
Sure.
With remote participation, it's probably less of an issue, but
I think it is in part because, yes, they could log on via Zoom, and we do also record it and post on YouTube, but it is a fair point. The board had previously, to expansion to 5 members, had met on the second Friday, and then once or twice a year, it would hold the night meeting, as, you know, basically to say, if you can't come see us in the morning, we're happy to do it at night. I think the morning was a function in part, Steve, of you and Jane having clinical schedules and that working. No.
That was established well before my time on board.
Oh, okay.
I work 24/7, right? So having a 7 a.m. shift, you know, 7 a.m. actually took out 2 shifts for me because I couldn't work the night before and I couldn't work that day. But that's what it had been from time immemorial. That, you know, they said this is what it is. It's fine. I walked it off. You know, no problem.
Sure.
You know, but you know, we met with a fair amount of criticism because not everybody in town wanted to be up at 6 in the morning to get to the 7 a.m. meeting when they were trying to get busy with their kids and get off to work. So we were seen as, you know, being pretty isolated and inaccessible. And that's why I think when I was chair, I actually said we're going to do a couple of meetings each year in the evening for that very purpose.
We were getting some pressure from the select not to do that. And I was just recently at Mass Association of Health Board meetings where a snide remark was made at 7 a.m.
Interesting. Okay. Does the board want to try to go through right now, or would you prefer to go through a scheduling application to try to figure out what is the best recurring day or time?
I think we brought the idea up. Maybe it'd be good if people had a chance to think about it.
Sure. Great.
We could put it back on the agenda next month or something like that.
Or by email in between, even just to see if there's certain slots.
In general, just given, you know, that other people express travel schedules, midweek is probably better than Mondays and Fridays for you. Would that be a fair statement on average?
I think most of the travel is actually more midweek.
There's more midweek.
Yeah. I don't know.
Mine is usually just in chunks, so it's like, yeah. So it's kind of different.
Yeah. I'll think about it. And then the other thing was the discussion about having a regular public comment period at the beginning, and maybe having some rules and regulations around that.
I don't know if we're, you know, looking for an answer to a problem that isn't a problem, or a question that has been asked, but I do think it provides an opportunity for someone who, you know, has a question or is interested to get the board's attention, you know, without essentially having to figure out the situation getting to the point of getting an agenda item taking 15 or 20 minutes. The person who was interested in talking to us, but then decided they weren't comfortable speaking in public, is very interested in the development that's going on at the former Muzzy site, and the fact that there might be biological laboratories built there, and is concerned that we don't have regulations yet for that. What's that?
They're not building a level 4 biohazard facility.
Worse would be a level 2.
True, but I do actually worry less about a level 4 than I would about a 2. Just I think, you know, partially that misunderstands our process. We don't develop regulations for things that don't exist. So if there is a proposed use for that, then we can do research on best practices. We can look what other communities have done. We can hold public hearings, and the board can decide whether it's appropriate to adopt a regulation. And if the board is interested in us starting that process, we're happy to do so. But the idea is that it would give someone who had a comment like that a chance to directly speak to the board.
Yeah.
The select board obviously has a broader scope than the Board of Health, and it's not used at every select board meeting. So I don't think there'd be a long line here very often, but.
I mean, to the lab space thing, I mean, it sounds like it's definitely happening that it's going to be lab space. That's everything that I've read about it. So seems like we should be at least starting to, get on top of that, given that seems to be the proposed plan.
Mm-hmm.
Yeah, and I will say that that's a small, we looked at the Cambridge regs, we talked about it. Towns don't have a lot of involvement, it sounds. Everything's sort of at the federal level, and they have biosafety committees and things that oversee it. So, and then the chamber just put out a little citizens guide on laboratory space that it could be helpful to share, because Wellesley has a lot of that happening as well too. So the neighboring communities. So that might be a good resource that we can share.
Yeah, we still need to be aware though, because it's all well and good that the regulations might be federal, but when there's problems, it'll affect our town.
Right, and the management on site, I totally agree. Can I just go back to the meeting schedule? I think it makes sense to sort of, if you want to start in March or something, but get something more regular. This causes Tim and these guys a lot of time back and forth trying to work out schedules. Like, could we set, 9 a.m. Friday, starting in March, second Friday? I don't know, something that works for people, and you sort of set your work schedule around it. So I'm saying as a person who can attend anytime, any day, but
Sure. So I think that's what we're going for, is figuring out with the board what is a permanent schedule, but understanding that we can't implement the permanent schedule in November. So we would still have a couple months where we're kind of on a rotating basis for a few months, but then the goal would be maybe by November we set a set schedule beginning in April or something.
okay, as long as you're
6 months to phase in.
And I think it accommodates the people who have traveling issues.
Sure.
I can pretty much with some warning come anytime, except Monday nights.
Okay. All right, great. So I will, if the board members can think about that, I will send around an email and start the process of saying, okay, is Tuesday better? Is Wednesday better? Is Thursday better? Is evening or morning? I do think having the ability to meet remotely does give us a lot more flexibility, and having 5 members means that if someone does unfortunately have to miss a meeting, there's still a quorum. Right.
I work nights, if you want to have a meeting at 3 a.m. I'm good.
That would definitely not go over well.
That patient come in, that's a meeting.
Yeah, no, there's that.
Okay. Next meeting in November.
We do, yes. November 11th, which is the Friday, I believe, is Veterans Day.
Yes.
So we'll probably avoid that one.
I think they do celebrate on V-Day.
But this is just going to be challenging for me. There AMA meeting is out of town, and I'm gone from the 10th to the 20th, and pretty much working every day. So
okay,
we'll see what people come up with, and
okay, so I'll send a doodle poll.
Sure.
Okay.
But yeah, the meeting this year is in Honolulu, so I'm not going to be rushing home.
we feel very good.
Yeah, definitely.
It is a business meeting. I will have you know.
Sure. We don't have
see if you come back with a tail.
You will be definitely attending.
Yes.
So okay, so can I have a motion to adjourn?
Motion to adjourn.
Second. All right, start with Kathleen Brown.
yes.
Motion to adjourn. Yes. Good job.
Yes.
Myself, yes.
Yes.
Yes. We are.
Thanks, everyone.
Thank you.
And